US now leads the world in confirmed cases. Hello everyone, we are trying to take some initiative to spread awareness about virus COVID-19, which is also known as corona. We are making content on coronavirus to spread awareness about this pandemic. Unemployment data set a bleak record and hospitals struggled with an influx of sick patients and lack of equipment. But the White House Coronavirus Response Coordinator dismissed talk of shortages. Here's what you need to know. The US now leads the world in confirmed coronavirus cases. Early graduation could send medical students to the front lines. A deal for thousands of ventilators seemed imminent, until the announcement was cancelled. A Navy hospital ship is headed to New York this weekend. Hot spots are developing in the Midwest, and vaccine trials are underway. Pelosi predicts bipartisan passage of $2 trillion stimulus in-house. Ohio will conduct its presidential primary mostly by mail. The US now leads the world in confirmed coronavirus cases. Scientists warned that the United States someday would become the country hardest hit by the coronavirus pandemic. That moment arrived on Thursday. In the United States, at least 81,321 people are known to have been infected with the coronavirus, including more than 1,000 deaths, more cases than China, Italy or any other country has seen, according to data gathered by the New York Times. Democracy, where states set their own policies, and President Trump has sent mixed messages about the scale of the danger and how to fight it, ensuring there was no coherent, unified response to a grave public health threat. A series of missteps and lost opportunities dogged the nation's response. Among them, a failure to take the pandemic seriously even as it engulfed China, a deeply flawed effort to provide broad testing for the virus that left the country blind to the extent of the crisis, and a dire shortage of masks and protective gear to protect doctors and nurses on the front lines, as well as ventilators to keep the critically ill alive. Several medical schools in Massachusetts and New York announced this week that they intended to offer early graduation to their fourth-year students, fast-tracking them into frontline hospital care as the need for medical workers surges. On Tuesday, the Grossman School of Medicine at New York University became the first in the United States to announce an offer of early graduation, in an email to students. That followed similar moves earlier this year in Italy and Britain, which advanced many final-year medical students into intermediate clinical service. On Thursday, the medical schools at Tufts University, Boston University and the University of Massachusetts announced that they plan to move up their graduation dates to April from May, after a request from the state of Massachusetts to help expand the medical workforce. Harvard Medical School said it was actively considering the same step. Dr. Stephen Abramson, Vice Dean for Education, Faculty and Academic Affairs at NYU Grossman, said the school's decision came as its hospitals were overwhelmed with an increasing number of COVID-19 patient cases. That led us to conclude, why not graduate students who are interested in serving in hospitals now? They've completed their requirements and they're prepared. The White House had been preparing to reveal a joint venture between General Motors and Ventec Life Systems that would allow for the production of as many as 80,000 desperately needed ventilators. Then word suddenly came down that the announcement was off. The decision to cancel the announcement, government officials say, came after the Federal Emergency Management Agency said it needed more time to assess whether the estimated cost was prohibitive. That price tag was more than $1 billion, with several $100 million to be paid up front to General Motors to retool a car parts plant in Kokomo, Indiana, where the ventilators would be made with Ventec's technology. Government officials said that the deal might still happen but that they are examining at least a dozen other proposals. And they contend that an initial promise that the joint venture could turn out 20,000 ventilators in short order had shrunk to 7,500, with even that number in doubt. Longtime emergency managers at FEMA are working with military officials to sort through the competing offers and federal procurement rules while under pressure to give President Trump something to announce. The shortage of ventilators has emerged as one of the major criticisms of the Trump administration's response to the coronavirus. The need to quickly equip hospitals across the country with tens of thousands more of the devices to treat those most seriously ill with the virus was not anticipated despite the Trump administration's own projection in a simulation last year that millions of people could be hospitalized. And even now, the effort to produce them has been confused and disorganized. President Trump said on Thursday that the Navy hospital ship USNS Comfort will disembark on Saturday from Norfolk, Virginia, and arrive at Manhattan's Pier 90 on Monday, 3 weeks earlier than expected. The ship should bolster the capacity of New York's hospitals, which are straining with patients suffering from COVID-19, the disease caused by the coronavirus. Mr. Trump said that he would personally see off the ship. Hot spots are developing in the Midwest, and vaccine trials are underway. Deborah L. Birx, the White House's coronavirus response coordinator, warned of new hot spots developing in Wayne County, Mich., home to Detroit, and Cook County, Ill., home to Chicago, during the White House briefing on Thursday. But Dr. Birx tried to be reassuring. She said that 19 states that represent about 40% of the U.S. population still have fewer than 200 cases of coronavirus, and of the people with significant symptoms who are being tested nationwide, 86% are testing negative. She insisted that talk of ventilator and hospital bed shortages is overwrought. To say that to the American people, to make the implication when they need a hospital bed, it won't be there, or when they need that ventilator, it won't be there, we don't have evidence of that right now, Dr. Birx said. Also at the briefing, Dr. Anthony Fauci, director of the National Institute of Allergy and Infectious Diseases, said the timeline for the development of a coronavirus vaccine was proceeding faster than usual, but would still take at least a year. He said small Phase 1 trials have already begun, and that he hoped larger Phase 2 or Phase 3 trials could begin by the middle of the summer. Speaker Nancy Pelosi said Thursday that the House on Friday will pass the $2 trillion stimulus bill to respond to the coronavirus pandemic with strong bipartisan support, after the Senate's unanimous late-night vote to approve it. She said the House, which has been in recess for the past week with lawmakers scattered throughout the country, would consider the measure on a voice vote, so that members who wanted to register their positions could do so audibly on the House floor, and others who could not or did not want to return to Washington would not be obligated to cast a vote in person. I feel certain, that we will have a strong bipartisan vote, Ms. Pelosi said at a news conference on Thursday morning. The measure, the largest economic stimulus in modern American history, would send direct payments of $1,200 to Americans earning up to $75,000, which would gradually phase out for higher earners and end for those with incomes more than $99,000, and an additional $500 per child. It would substantially expand jobless aid, providing an additional 13 weeks and a 4-month enhancement of benefits, extending them for the first time to freelancers and gig workers, and adding $600 per week on top of the usual payment. The package also includes $350 billion in federally guaranteed loans to small businesses, and would establish a $500 billion government lending program for distressed companies reeling from the crisis, allowing the administration to take equity stakes in airlines that received aid to help compensate taxpayers. It would also send $100 billion to hospitals on the front lines of the pandemic.
Thanks for watching. To stay updated about pandemic COVID-19, subscribe to our channel and press the bell icon.